Good afternoon, and welcome to this afternoon's regularly scheduled Emergency Operations Center press briefing for Monday, the 20th. We have for you today, based on the numbers of positive cases here in Blackhawk County, brought back our medical directors and medical staff to address some of those concerns. So we will start off as we normally do with our Director of Public Health here in Blackhawk County and Incident Commander, Dr. Nafissa Cisse-Egbuonye.
Good afternoon. I want to always begin by thanking the community for all your continued efforts to staying at home, masking, and practicing social distancing. I know it's not easy, but thank you for your continued efforts, and our local partners for all the hard work that they're doing to support our community members. The childcare organizations and also the education system, thank you for taking care of our children. We're so grateful for all that you do. As of this morning, there has been 356 reported cases of COVID-19 in Blackhawk County. This is over the double the number of cases we reported at our last briefing, and we are expecting this number to continue to rise in the coming days. We continue to work with our state and local partners to respond to this increase in reported cases, and we're working to complete follow-up cases as quickly as possible. And I'm very sad to report we've had 2 additional deaths that have been reported related to COVID-19. It's an individual, one individual of age 41 through 60, and one individual age 61 through 80. So our thoughts and prayers go out to their families, and we ask people to be respectful of their privacy and as they go through this difficult time. We continue to monitor the outbreak associated with Tyson plant in Blackhawk County. And over 90% of the cases in Blackhawk County have been reported since the outbreak at the Tyson plant was identified. To the Tyson employees who are listening, if you are sick, you need to stay home. You should not go to work, and you should stay away from other people you live with for at least 7 days after you've started feeling sick. So staying away meaning isolating yourself if you can, and until you have not had a fever for 3 days. If you work at Tyson and live with someone who is sick, you need to stay at home for 14 days after the last time you were around the person who is sick. If you work at Tyson and you drive to work with someone who is sick, you need to stay at home for 14 days after the last time you drove to work with the person who is sick. These are all the things that Tyson Food is aware of, and we have been in communication with them and informing them of these guidelines. So management at local Tyson is aware of these protocols. And in addition, if you need help with any other issues such as food and essential items, set up appointments and interpretation with medical providers, applying for unemployment, WIC, energy assistance program, and safety or other issues, please call Embark. They have interpreters available to you all. And due to the diversity and the multiple languages here in Blackhawk County, this information that I'm sharing to the public will be translated in French, Lingala, Swahili, Karenni, Karen, Chan, Marshallese, Spanish, and Bosnian. Now, to all our business partners, we continue to get calls, and so we are going to continue to emphasize the need for you all to take precautions to protect your employees. So we're still getting numerous calls. This hasn't changed. We're getting employees complain about not having safer safety practices in the different organizations. So please. We need employers to take precautions. Please, we need you to promote social distancing and telework if possible. We need you to allow employees who are ill or need to self-isolate to remain home. We need you to increase cleaning, particularly of shared and frequently touched surfaces. We need all businesses of every size to take these precautions, especially those employees who work in areas where they have the limited ability to do social distancing. We need the public to continue to stay home and to prevent the spread of COVID-19. We're still getting calls about seeing neighbors being in large group settings and different groups of people just congregating. That needs to stop. You've heard the governor. We need everybody to stay at home and stay at home with your immediate family. So if grandma and grandpa doesn't live with you, you need to stay at home with your immediate family. Use technology to see each other and communicate with each other. We want to protect the health of the vulnerable population, so I urge you all to take this seriously. Our cases are increasing, and you know there's community spread, so please continue to stay at home and self-isolate. You should stay at home when at all possible, and you should only leave your home for essential services. If you leave your home, you need to practice social distancing. You need to wear a face mask and return home as soon as possible. You should not have any visitors at your home, and you should not visit people as well. If you are ill, you need to self-isolate away from other members of your household for 7 days after the start of your illness, and you have been fever-free for 72 hours and your symptoms have improved. If you live with someone who is ill, you need to self-isolate again for 14 days after your last contact to the ill household member. We also need you to continue to practice the 3 C's. So cover your cough with a sneeze, or cover your cough and sneeze. You also need to wash your hands for at least 20 seconds with soap and water. Practice that with your children. Teach your children to be able to wash their hands for at least 20 seconds. And contain illness by staying at home when you are ill. So this is, again, I've stated in my last briefing that this is a very difficult time for the community. This is not it's not an easy time right now. We are feeling the impact of COVID-19, but I do believe that this is something that will pass. This is something, so as difficult it is, I want everybody to still be hopeful, and we will combat it together, and we will get back to our normal lives. But right now, we need everybody to continue to implement those preventative measures. But most importantly, stay at home and only go out if you need to. Thank you.
Our next presenter is the Chief Medical Officer for MercyOne Waterloo, Dr. Matt Sojka.
Thank you, and good afternoon. I want to talk a little bit about what's going on in our facility. We are starting to see what we call the surge. We're having increased numbers of patients with COVID in our facility, and with that, we have a plan together, level 1, 2, and 3. Our first level is that our main ICU is being dedicated to only COVID-positive patients. We are using our PACU for a secondary patients that do not have COVID, and we are continuing to watch that and monitor that and the needs of the patients that we serve. And additionally, we do have, as I said, other plans, steps 2, 3, and 4, and there's a lot of detail behind those from providers, nursing, support staff that go on. But very proud of our group as we've come together for this first level of surge. We are increasing the testing at our Fury Clinic on Ridgeway Plaza. We've had constant increased numbers. Also, we have testing that we received on Friday from Trinity Health, which is called Cepheid. It is a short order test, takes about 90 minutes to get the results back. We're reserving that for inpatients. So when they come into the hospital, we know whether they do have COVID or they don't have COVID, and we can put them in the right place to monitor them, to give them the right PPE, and our staff the same way. We did receive the Abbott equipment on Friday. We have not implemented use of that yet. There's some discussions about where that's going to be best served, but we are continuing to monitor that. Our virtual visits continue to increase also. So if you have a MercyOne provider, please call for a virtual visit if you need to talk to someone. If you're sick and you think you need to be tested, then call the 272-CARE number. So that way we can get you through the process and get you tested if need be. One of the other things out there, as we talk about the surge and we're worried about the increase in patients, we also look at what our elective surgeries have been, hips and knees that we can't do at this time. And CMS also issued some guidance late last week about, well, if the numbers are going down and the community is stabilizing, when do you consider doing those? Obviously, we've got doubling of the numbers since Thursday, so we're not in that situation yet. But we are talking about that as a leadership. How do we care for those patients that have other needs out there? So we continue to work with that. The other things, I just have to say the isolation. As Nafissa said, stay home, stay by yourselves. I'm sorry, it seems like a lot. I'm tired of being around my wife when I spend time with her, but that's about the only person I spend time with. I was out for a jog yesterday by myself. I ran across a backyard. There were about 10 to 15 people. I could see grandfather sitting there. I saw 2 young children running around with balloons, and they were all out there. And I'm going, someone's probably a carrier. There are a lot of asymptomatic carriers for COVID. So someone may be giving it to grandpa without knowing it. And that would be very sad. So please stay at home. If you go out to the grocery stores or things that you need, wear a mask if you have one. Keep your distance. Wash your hands. Just please do the right things. Thank you.
Our final presenter this morning is Dr. Sharon Duclos. She is the co-director of People's Community Health Clinic here in Waterloo.
Hello, everyone. I hope everybody's doing well. So for an update at People's Clinic, I'll start with that first. As we've all said, we're seeing the surge. So we're definitely seeing the surge down at People's Clinic. And as that starts to happen, then of course you change your processes. And so we're kind of doing what everybody else is doing. We have our sick side and well side, and needless to say, our sick side is really taking up nearly our whole downstairs as we start to see the surge. So we are seeing sick people. At this point, I don't think we have the capacity to test asymptomatic people because we really want to stay on top of the sick people that we are currently that we are currently seeing. So we can triage them out as far as the ones that we feel like really need close follow-up, and the ones whom were the worry welled had mild symptoms and came and just needed some reassurance, and they don't need a lot of hand-holding at this point. So it would be very hard for us to do some asymptomatic testing at this point, but as we change our processes, our goal is to increase capacity the best we can. So that's as far as People's Clinic, as far as what we are doing. Loving my providers, loving my staff. Couldn't work in a better place. I tell you, they just rise to the occasion, and it's great watching them work. It's great watching the process. You know, you're upstairs, you come up with a new process, we have a new problem, we're working on that problem, we go down, we give them a new process, and immediately as they start to work, they're like, hey, this will work even better. We can even be more efficient. If we're more efficient, we can see more patients. And so hats off to my employees. I love working with them. I just can't say enough about them. I can't overemphasize either the need to really stay at home and self-isolate. A couple of things, and this is what I've heard, making phone calls, listening to my staff. So if you're sick at home, really, if you can, Do a designated sick room. Isolate yourself as much as you can. I can't emphasize how important that is, because it is now up to you to say, I need to try to stop the spread. I need to try to stop this from going to someone else in my household. And so if you can have a designated place where the sick person is there the majority of the time, it is helpful. Now, I know, and especially from our patients, there's a lot of people that live in a home. And so a lot of our patients, they just don't have the luxury of designating a certain, sick room to kind of help with that. But then the social distancing in your home when you have somebody sick is very important. Really trying to limit, trying to be that 6 foot apart. Really doing the hand washing, that is so important. Sometimes people don't realize that, so I'll tell my patients, let me give you a visual. And right now you can go home because we're asking you to all go home and stay there. So I want you to go home and have some fun. So when you go home, I want you to go into the kitchen and I want you to get some flour out. And I want you to put it on the counter. Put flour on the counter, put your hands in the flour, and then start touching everything. See how long it goes. Okay, where you see the flour. Everything you touch, you will start to see a little bit of flour. So make it a visual. That's the hard thing about viruses. There is no visual. And so one half of your brain wants to go into the denial stage that I'm not going to get this. I'm not going to, worry about it. I can't see it, so I'm okay. The other half needs to kick in and say, okay, I can't see it, but it's there. Okay, obviously the numbers, they're going up. So this is not a hoax anymore. It really is happening. For those of you that don't think this is happening, it truly is happening. And so just go home and do that test, and then you kind of get an idea of how viruses spread. I mean, that's a certain way. So just throw the flour, put your hands in it, start touching things, and that gives you a little visual about how quickly these things can spread. It also gives you a visual to realize how much I really need to clean my countertops now, my doorknobs, your cell phone. Boy, you got your phone all the time. People take the phone to the bathroom. We know we all do it, okay? You're washing your hands, but there's your cell phone. You're not washing your cell phone, so it's amazing the number of germs that get on your cell phone. Oh, I'm doing really good. I'm washing my hands. Grab that phone. Oh, there we go. And so really wash that phone a lot because we all have those. So just make that a habit to do that. Lastly, the thing that would help, I know us at People's Clinic, this is my plead to the businesses. So now we're seeing a lot of sick people. The sick people don't work all in the same place. And so as you diagnose a sick person, you're then telling the sick person, who all lives in your home? Where do they work? The people that live in your home now, they need to stay at home. This is how we stop the spread. They need to stay at home. So now they need to call their employer. And so when we see a surge, please give us a break, because if we have to write a note for everyone that needs to be quarantined, then it's very hard to see anybody. So employers, you're going to have to either use the same phone note that we gave to the patient. Somebody's at least getting one note. Whether you see a copy of that note, however you want to work it in your organization, but please do not make it be the same way. You're going to have to change your process like we're all changing our process. And that would truly help us out a lot if we didn't have to deal with that one phone call after another phone call. We really want to take care of people who are really sick. So we've had people come in short of breath. We've had to get them to the emergency room. They were waiting, and if we can't see those patients, if we can't get to them because we're having to worry about all this paperwork to help other businesses, then those are the ones we're going to miss. And gosh forbid, I just don't want them to get poor service because of that. There's only so many hours in the day. We only have so many people that can do what we do. And I have to pace my employees. Again, one more time, this is not a sprint, it's a marathon. And when I say a marathon is it's not a few weeks here. A marathon is longer than that. We're looking at months. So employers out there that have been in the denial stage that I need to change the way we're going to do this, that, in a few weeks they're going to lift this, it's going to be business as usual. Think again. Get your head out of the denial stage. Get your head out of there. Because this, let's talk about potentially worst case scenario. It's a new virus. We're not for sure what it's going to do. So my plan is always, I want to know what is the worst case scenario. The worst case scenario is we're doing bad here. Okay, we're doing better, but all of a sudden we're doing bad again. So that could be in the fall. You know, I keep going back to the Spanish influenza. You're sitting at home, you don't have much to do. Read about that. That went on for nearly 3 years. 3 years. This is not a sprint. It's a marathon. And so for businesses, now you have to think about how can we keep our economy going, our businesses going safely at a distance. And it is putting up the plexiglass. It is helping people be able to work 6 foot apart. There's a lot of things you can do. Hats off when I go out and get my groceries. They've done a lot of great changes in order to help protect their employees. You know, keep it up. That just makes me feel so good. You feel safer when you walk in there seeing the changes. And that's important for your employees. Your employees, they're out there working. These essential employees, I can tell you half of them have some kind of chronic illness. You know, and we're sitting, I'm sitting over here saying, you be careful, 60 and older, you know, comorbidities, you're at risk. And then I get the phone call, well, if I'm at risk, I don't want to go to work, Dr. Duclos, give me a note. I don't want to go to work. Well, how long do you want this note for? Because this could go on for 3 years. So it's here, we're going to have to deal with it, but that means we do have to get up and go do our job. And it means that you have to force your employer to really help you be as safe as you can be in your environment to do your job. You know, you have to demand it over and over and over again. That is so important. We all can't go home and hide from this. We all can't work. I've had to go down that path with my patients over and over too. So, because they finally get to, you know, I don't want to deal with this, and I don't know why they just can't shut everything down. I've heard this, I don't know how many times, I don't know why they just can't shut everything down for 2 weeks. Well, let's go down that scenario. So now you're sitting at home, you don't have electricity, you don't have running water, your phone's not working, you can't go get food, you can't go get gas. Life stops. We can't live that way either. That's anarchy. We can't do it. So we have essential services. We do have to work, but we need to work safely. That means we all have to work together, and that means employers, you really have to be creative to keep your employees safe. So I really encourage you to do that. Thank you.
On our lineup today, it indicates on Thursday those speakers are to be determined, and I think on Thursday we're going to try and do a do-over and invite Andy Petit and Dr. Jane Lindemann back to address some of those school concerns, and also potentially Amanda Goodman from Family and Children's Council to try and address some of those youth concerns that we had originally slated for last Thursday when we experienced that major shift. So that's kind of where we're thinking about going on Thursday. Pursuant to your questions, that concludes our prepared remarks.
2 additional deaths or 2 deaths total?
We have a total of 3 deaths.
Okay. That's my question, too.
What was the new one? Or were there multiple ones over the weekend?
It was one.
It was 2 additional from our last reporting.
You said 90% of the cases that we've gotten in the last, couple days are attributable to Tyson. Can we say the same thing about the deaths, or is that information that you can't?
That's confidential.
Okay.
I can't really say.
We have a question from Iowa Public Radio. Is Blackhawk County working with interpreters to do contact tracing, and who is providing the interpretation?
So I believe that the interpreters, it's a language line we use to do the interpretation services. Yeah. And also, one of the things that we're realizing is there's barriers with that system. It's more efficient to use than in person because of just the different dialects. And so we are working to also get some interpreters so to help those individuals, especially after hours, to navigate the system.
And Governor Reynolds has said her goal is to keep meat processing plants open and the facilities are being proactive. Are the steps she and Tyson are taking sufficient to protect public health?
So I can only speak for Black Hawk County at this moment. Since we went to visit Tyson on April 10th, it was very visible that implementing those measures, especially social distancing, was incredibly hard. And also the wearing of the face mask. So the following Monday, they mandated that. But one of the things that we are receiving is just communication from employees themselves not feeling safe. And so I can't speak on behalf of Tyson or Governor Reynolds, but I do know that we here at Black Hawk County have seen the surge because of Tyson.
When you mentioned that they're aware of those protocols that when you were talking directly to Tyson employees, those protocols, has Tyson made any sort of promise or commitment to follow those protocols?
Yeah, so I believe that they have they've mandated wear the mask. They've also try to social distance, create environments for social distancing in terms of their lunch breaks, those kind of things. And then when we were there, because I'm talking about the things I witnessed, they did show us the dividers that they were going to implement. I can't speak on whether they've implemented all of them, but that's what I know so far. And we've been in constant communication, asking them how are they doing in terms of just implementing those measures. But I think one of the greatest lesson also here is employee communication and the employees also understanding in terms of what's going on in the plants, because there is a lot of panic. And we're feeling that.
The County Board of Health is holding an emergency meeting tomorrow morning. Will they be recommending that Tyson close down? You had mentioned that was in their purview to do.
So the based on our the Board of Health attorney, the governor is exercising all of her power. So at this moment, the Board of Health does not have the authority to close down Tyson, but they do. We will be having a discussion in regards to what's happening at Tyson and what they can do from a Board of Health perspective.
Can you elaborate on what some of those actions could be, like hypothetically?
Making a statement, reaching out to the state, reaching out to the governor's office. So those kind of communications that need to occur at the state level.
The governor has said she will not yet order Tyson to close, saying she wants to keep the food supply up and running. That was what she said in today's briefing. What is the county's response to that?
You mean the health department, or I would wait for the Board of Health to speak on that. Mm-hmm.
Do you think she said that one possibility just to keep the supply chain open is to have it at 50% capacity? Do you think is that something that's feasible, that would be safe?
I don't know, because in order for it to function, you have to also have staff. You have to have employees, right? And so what we've heard is that there actually there hasn't been a good amount of employees to even run the plant. So at the moment, that's the current conversations that have been occurring.
Is there any information, or, and I know this is just kind of a rumor that we keep hearing, that people from other plants from Columbus Junction or Perry have come to Waterloo to work? Has there been any sort of...
So Tyson did indicate to us that was not the case. So that was their communication to us.
Is there any other confirmation of that?
No.
Could you help kind of clarify the testing situation? On Friday, the governor said that there were 2,700 tests that were sent to Black Hawk County for Tyson, and then today she said that there were 1,500 tests that were sent to 3 clinics in Waterloo.
It is 1,500 tests that came to MercyOne, Unity Point, and People's Community Clinic.
And are those specifically for Tyson?
No, those are due to our search. It's for that, but we are using it for Tyson employees as well. So, and it's for symptomatic individuals.
Do we know why there was a change between this 2,700 back down to 1,500?
You'd have to ask the governor yourself.
How many of those tests have already been used?
That's a good.
No, I'm not sure.
Several, yeah. I mean, we're getting a high volume, so. Yeah.
Iowa Public Radio asks, we've got the 90% of recent cases. Can you clarify how many of those cases came from Tyson and when the Tyson?
So at the moment, I can confirm 151 cases from Tyson, but we are still backlog in terms of just our investigation, but we know the bulk of it are Tyson related.
At Peoples, we're really trying to work hard with, we're trying to work
really hard with the health department because it is, all of a sudden you see the surge, and then you have a very diverse population, so it's kind of like once you have your interpreter and you have that person, the more information they give us to be able to ask them. And so we know when we get the phone call, so tell me how many people are in the home, where else do they work? You know, you try to get all that information because that makes their job a lot easier to do that contact tracing. So the more that we're working back and forth, the more that we're trying to become even more efficient to really go out there and help people and educate them. It's not a short conversation. I was on call this weekend and I was lucky to be done in 20 minutes per phone call, and that's all I did this weekend. All I did was try to locate people, to talk to them, to educate them. And there is a lot of panic, and you feel bad because they are at home, because they hear of a death, and now they have it, and they think it's doomsday. The good news is, majority of people get over this, so it's not doomsday. It's not, but we're just trying to protect, from somebody that it could be doomsday on. But we are working very close to try to get that information out there, and so they can do their job more efficiently also.
Switching gears just slightly, you mentioned that more people continue to call in with concerns regarding businesses not adhering to issues or employees being concerned. I know we've talked in the past about interactions with those businesses. How have those most recent interactions been?
So we are still planning to meet with some of the businesses this week, so we haven't met with any of them as of yet.
But no new action or citations or anything?
Most of our interactions with the businesses that we have made contact with have been via email, and it's been very positive. So most of the businesses get it. They understand both the job that we're trying to do, and they see us as the partners that we're trying to be.
And just 100% clear, no action, no citations or anything?
No.
Okay, thank you.
Again, we're trying to be resources and partners and implement best practices, educate on CDC guidelines, those kinds of things.
For those people that are worried that if they call in sick, they won't get paid and they're relying on that salary, what are their recourses as far as can they get short-term disability? Are they eligible for unemployment and that sort of thing?
That's not my realm.
So depending on, I know that if you're speaking in regards to Tyson, I do know that they did communicate with us. They have a short-term disability process. But one of the things that we've been communicating since the beginning of this is for businesses to be flexible and to be understanding. This is really an important time. It's not business as usual. People do need to stay. I mean, those isolation guidelines of 14 days. It's coming from the CDC down to us, and so I think that that's important for businesses to understand and really to trust their employees. I think that's one of the most important things is that we are at a time where we just have to believe that we're all here trying to do the best thing that we can. So trust your employees, have confidence in them, work with them so that they also know that they matter. Most of the time when you think about boosting morale in an agency, it's because of employees feeling that they matter and that they're important and their health matters. And so that's something very important for businesses to take into consideration.
Senator Dotzler and I think a couple other legislators reached out to OSHA to file a complaint and request that they come into Tyson. Just based off past experiences, do you think that OSHA, if they did decide to come in, would work with county officials whatsoever, like the health department, to kind of investigate that situation over there?
I think they would. But here at the local level, Tyson at the local level has opened their doors. That's also why we were able to go on April 10th. We made a phone call. I didn't have to call corporate. I just said, hey, we're interested in coming in to visit, to see you all with everything that we're hearing. And so they were willing to sit and talk and meet with us. So I personally cannot say that Tyson here at the local level has shut their doors to us. I've actually heard that we've had more successes than other health departments in terms of just communication. I can call them; they'll pick up their phone and respond to us. So we haven't had any barriers in terms of getting into Tyson or communicating with them.
Have there been any trends in terms of those employees who have been identified to have the virus in terms of people that they're working with directly on the line or family members? I took a call over the weekend from a viewer who said a lot of the spouses and partners of those who work at Tyson and Waterloo work at the Tyson Pet Facility in Independence. Are there any sort of trends that are emerging?
I think I'd defer to our epi. I mean, I'm not seeing. I haven't been communicated that there's any trends that we're seeing. I think that one of the things for us is the contract tracing, right? So people live in group settings, in larger group settings, and then they ride sharing. And also the different interactions they have within the plant. So that's just been a lot. And I want to also emphasize how the health department has been working Monday through Sunday. I mean, boy, I'm the one that's fortunate also to have a great staff because it's just been one of those things that it's been difficult, but we'll get through it.
To clarify a bit, I know we've talked about Tyson's trying to get those plastic barriers to put on the lines between workers. Have we? I know nationally we've talked about social distancing, keep your feet apart. But are we seeing the cases come out of the facility as being people who work directly next to each other? Like, do we think that those?
No, that's not how it works. Yeah, no, that's not. That usually it's during the contact tracing that you identify who's been in close proximity, but it's not the confirmed cases. It's just those that are being tested. So we still do the contact tracing. So for us, it's irregardless of whether they're in, sitting face to face with each other during lunch or at home, we still would.
Okay, I just wasn't sure if we knew where the infection was occurring in the plant, if it was on the line or if it was in the break room.
No, it's just more of it coming from the plant.
Okay.
Yeah.
One more question from Iowa Public Radio. With the surge, can you speak to what percentage of patients have to be hospitalized, and do you have a sense for how long the surge will last?
No, we don't have a timeline. I mean, this is. We don't have a timeline at all. And in terms of the hospital percentage, do you guys have? We don't have a. We don't have a number for that. But like I said, this is Dr. Duclos made it clear it's a marathon. And we're all feeling it. But I think that the most important thing is to be able, at the local level, get the resources such as testing to be able to test individuals and to be able to ensure that we implement those preventative measures so that the community is healthy and we get back on track. So.
I have a question for Dr. Nafissa. You mentioned a PACU and a Cepheid. Can you explain what those two terms are?
Okay. Our PACU is our post-anesthesia recovery area, and we use that. Cepheid, CEPHEID, is one of the tests out there. So that is one that we have gotten in. Trinity Health obtained that for us, and through our partners, we're able to do that.
And that's a 90-minute?
About 90 minutes. We can do 4 tests at a time for 90 minutes, and that. One other thing we have done is we have signed up for the study on convalescent plasma, which has the immunoglobulins in it through Mayo Clinic. So we are on board with that if and when that comes to be a need in our facility.
Question probably for Nafissa. Are there any plans at this point for a follow-up visit to Tyson, since it has been about 10 days and the numbers have really risen tremendously since that one visit?
No, not at the moment.
This question is for Tony. Tony, have any other elected officials signed on to the petition, or has anything changed in regards with that?
I believe there was a couple more mayors that signed on to it after it was sent. I'm not sure what the significance is or how that actually works. You could talk to Supervisor Schwartz with regard to that, but
Is that updated list in the back here?
I don't believe so. I'm not sure.
Just kind of regular question, are we continuing to get PPE shipments?
So today I received from our wonderful partners at John Deere a very nice supply of face shields, some eyewear, safety glasses, and a few boxes of N95 masks. I contacted EMA early this morning on my drive in and told them to reach out both formally through our supply requisition requests, our formal requests, but also to reach out telephonically to Iowa Homeland Security, let them know what we're faced with, let them know what we need, and to let them know what our ask is going to be, because we are seeing thousands of pieces of PPE being requested. And again, remember the whole green, yellow, red. You know, green is good to go, yellow is concerning, and red means we're either out or nearly out. Because of the number of testing that is occurring, the type of testing that's occurring, and the amount of hospitalization or interactions that are occurring both at clinics and the emergency departments, that run on PPE is happening just exactly the way we thought it would happen. So that personal outreach, as well as our formal request, we floated an enormous request for PPE that they thought that they could backfill a majority of that request tomorrow. So between our partners at John Deere, which was outside of the normal traditional request channels, they went direct with the hospitals with a lot of their PPE, as well as dropping here for our long-term care facilities and outlying clinics and things of that nature, home health care workers and those kinds of folks that we're supporting. And then on top of this major request that we have today, we do plan on probably pushing another request up the chain before the end of the week. We'll see what we get tomorrow, but I'm hoping for pallets. And so right now, this morning, my briefing was everybody's green, but everybody's concerned, because the shift that we experienced over Thursday of last week to now has changed the draw on the equipment that they would normally say green, good to go for 7 days. We may be green right now, good to go for 2. So we're quite concerned.
What are you hearing on the state stockpile?
You know, I don't think there is a stockpile anymore. I think the state is direct requisitioning, and I think it's going right from their requisition point right onto trucks to us. So through DIA and DAS, right to us. So the state is doing a remarkable job at trying to keep up with the demand that's being placed on them.
Shifting away, we've talked so much about Tyson in the last few days. Long-term care facilities, have they seen any increases in cases, or are they kind of remaining? I know other parts of the state have seen that. Have we?
No, not at the moment.
From Iowa Public Radio, do Blackhawk County hospitals have enough capacity, PPE, ventilators, and staff to care for patients during the surge?
At this time, we seem to be well situated for where the surge is at, but it matters how high that surge goes. And if I had a crystal ball, I could give you a better answer.
If there are no other questions, that concludes our briefing for today. We appreciate you being in attendance, and we certainly appreciate you being online. We are looking forward to entertaining more of that through more of a virtual press conference when possible. Obviously, as more people tend to populate this small room, you're about at the max limit of what we're able to entertain here. So if anyone wants to participate via the virtual press conference, please see Gabby up here in the front, and we can coordinate that with you through her, and she will be your spokesperson for the press conferences. So with that, we appreciate your attendance, and we will speak to you on Thursday. Thank you.